It is Health Diary. Thank you for joining us. My name is Gladys Gachanja, and today we're coming to you from the Aga Khan University Hospital. The backbone of any country is the health and wellness of its people. Quality healthcare guarantees governments to safeguard its citizens from disease and provide quick and lasting solutions in case of any affliction. Today, excellence in healthcare is our focus, but before we get to it, actually starting off with this fact of a matter.
One of the main features of excellence in healthcare is clinical excellence. Clinical excellence is the way you manage your patient when they come to you. And that has to be guided by evidence-based medicine. It should not be a free-for-all that you believe that this is what works and this is what you prescribe for your patient. It should be shown by research, evidence-based medicine that is published in the literature. 1 year down with COVID, we've learned a lot. That there were initial medications that were used in COVID, such as hydroxychloroquine, zinc, which we know are no longer recommended for patients with COVID. And that has been because of research. Research has shown us that this is what works and this is what doesn't work. As a hospital, the way we do it is we have a team that sits and writes protocols to say if a patient comes in with this is how we're going to treat them. We don't dream it up. Again, this is the literature telling us, the evidence, the research that's done in different parts of the world and in Africa itself that tells us what we're supposed to do.
I like to say I'm a breast cancer surgeon by day and a health systems researcher by night. And my research focus is on understanding the barriers that exist for women who have cancers in sub-Saharan Africa and in East Africa and Kenya, and designing interventions that talk to those barriers. Globally, breast cancer is still the most commonly diagnosed cancer worldwide. And in Kenya, our statistics are not any different. How do we change the narrative for patients in sub-Saharan Africa? And it takes a deliberate strategy, not just, wishing that, things would become better, but taking active leadership roles and looking at how are we motivating health workers to do better? How do we ensure that patients, if we look at the causes behind why our women are diagnosed with advanced cancers, it comes through to a constellation of reasons. One is the fact that patients have to pay out of pocket for their cancer care, which frequently results in catastrophic health expenditure. And although there have been attempts by NHIF to mitigate some of the costs, whether it's chemotherapy or radiotherapy or surgery, the cost is still pretty prohibitive for quite a number of patients. So how do we make ourselves more effective as health workers to better diagnose these cancers in a timely fashion? And that comes through education and training, teaching our health workers what are the common signs and symptoms of breast cancer, and looking at how do we then get them to identify and refer appropriately where necessary.
So, excellence in healthcare. So, how are you supposed to achieve this? How can this be achieved? We have ladies here to help us along with this conversation. I'll start off with Professor Marlene Temmerman, who is the Chair Department of Obstetrics and Gynecology and the Director of Center of Excellence in Women and Child Health at the Aga Khan University, and also Dr. Nancy Booker, who is the Assistant Professor and Director of Academic Affairs at the Graduate School of Media and Communications at the Aga Khan University. Ladies, thank you for joining us. And I'll start off with you, Professor Temmerman. How would you define quality healthcare to start with?
First of all, come back to Kenya, where we have a system with 6 levels of healthcare. The community healthcare workers, dispensaries, and we go to the health facilities, the hospitals, referral hospitals. So quality has to be defined at the different levels. But talking from a hospital perspective, we have a lot of indicators. Like if a woman, a patient, in my profession it's always women, they come to a healthcare provider, there are a number of criteria. It is about the right person to listen to your problem, to do the right investigations, to examine you, to do the right technical laboratory and whatever, to come back to you. and to explain why we are doing what is the best approach, what is the best treatment. And very important is that that quality is evidence-based. What does it mean? In the old days, when I was in school, one professor said A, the other professor said B, because I say so. This time is gone. We have research, we have data, we have a lot of information available that we have to use in our approach to the patient.
That said, what are some of the factors that actually affect the same, Dr. Bukar?
Coming from a journalism and a communication background, a lot of it has got to do with access to information and access to the right information that's factual, that can be verified, can be triangulated, so that then if you're making any decisions, you're making decisions based on data that's available. And for that quality healthcare to be achieved, then, communities, the population has to have access to information that then allows them to make informed decisions about their own health, but also the health of those people that they care about. And I think what this then means for us is that when you're thinking about quality healthcare, you're looking at it from very many factors. The hospitals, the medical teams are just one facet of that. The community and the amount of information and even the sources of information that they're getting are an integral part of that equation. So who's the person who's providing this information? Do they have the knowledge? Do they understand? Are they able to break down complex science and research into a way that makes meaning, for the consumers, into a way that is understandable so that people can make informed, decisions about their own health. So there can be a lot that's going on in terms of research, in terms of, a lot of progress in the medical field. But if that information is not trickling down to, the people who need it, whose health is determined by a lot of that information, then you're not going to see evidence of that quality healthcare.
And speaking of which, how has the pandemic underscored the need for quality healthcare? Because there are a lot of lessons coming out of this.
A lot of lessons. The pandemic has really changed a lot of our behavior of providing healthcare and also perception of healthcare. And maybe I can elaborate a bit. Even before the pandemic, the healthcare structure is like what is given to the population, what is given to the sick patient. Now, the perception of the recipients of healthcare was never taken into account. It's like in maternity health, we know what kind of care we are offering, but how the woman is perceiving this care, how is she understanding it, how is she valuing it, it can be different. Normally, you offer, patients are coming to the hospital. In the beginning of the pandemic, there was a lot of fear. Population was thinking, I don't want to go to the healthcare sector because I will get COVID there, not realizing that it was even more safe in a hospital than on a market or wherever. But we have learned alternatives, looked for alternatives. Like in pregnancy care, prenatal care, women do come from time to time, but we also do telecommunication. So the interaction has changed a lot. We have learned how to deal with it, and that's good. There is a silver lining to this.
Certainly, I think what the pandemic has done is that it's also pointed us towards an appreciation of research and data. A lot of the decisions that are made, even in terms of, at a national level, at a global level, are determined a lot by data, by numbers. I look at our country, for example. At what point do they lock down? Does the government lock down? At what point are there, additional protocols? It's the numbers that then, inform the decision making. One of the other things that we've also seen is that with the pandemic, there's been a lot of data. And just being able to break down this data into ways that people can understand them, can make meaning out of them. There's also been a lot of misrepresentation of that data, that has led to anxiety in some cases, a lot of misinformation. So it's ensuring that whereas that data is available, who's fact-checking it, You know, are we able to fact check? Are we able to verify that information? Who are the voices behind that data? And also, you know, just ensuring that receiving that data set is one part of it, but having people who can engage, who can speak from positions of authority around what those numbers mean, you know, is an important part of a lesson that we've learned as a result of the pandemic.
The right to health, I mean, the accessibility, the availability, the acceptability, the affordability of the same, these are factors that feed into the quality of healthcare. Why are these so important?
Let me give you an example. From my profession again, in Kenya, we had in 2014 quite a high maternal mortality rate. So the ministry, the government, Beyond Zero initiative, everyone was working together on how can we improve that? How can we improve prenatal care, accessibility, affordability, and make sure and understanding so that women know it is important that you come to the antenatal clinics. A big success. So more and more women do come for their antenatal care. Now, second step was now moving the population into delivering in a health facility. But this is a different story because there's the same health facilities with the same number of midwives and nurses, with the same provision of care, but now they are doubling the numbers of women who are coming in. So we don't see an improvement of maternal mortality rates if we don't take into account, into the equation, that we also have to invest into quality of care at the moment of delivery. So it has a joint effort that we have to do all together. We need the data, but we also need affordability. We need NHIF for all. We need to make sure that all Wananchi really can have access to basic health care, good quality health care, which is easier said than done because there are so many factors that play a role. It's awareness, but there's also quality of the healthcare services.
Dr. Booker, we talked about information feeding greatly to the right to health. How do you rate the healthcare sector in as far as how they handled the pandemic or how we relay information around health, considering not all are trained in health?
That's a good question. And I think when you look at the pandemic as a case study, you know, where we started, I think at the very beginning, everybody was, you know, saying whatever they knew was right.
Dr. Google.
You know, looking at different scenarios, you know, trying to map out what this would mean for our context. And so there was a lot of information, and you were getting it from very different sources. You know, and part of the challenge was, you know, even those that are charged with the responsibility of providing us this information or breaking it down, which is the media, were also, you know, in a state of confusion. You know, what do we give? What's factual? What isn't? You know, where are we getting the sources from? Who are we going to speak to? Once we kind of got the hang of it and realized that this story wasn't going anywhere, you know, that we had to live through it, then there was a lot more thinking about, you know, how do we ensure that the right information is getting out? How do we ensure that we reduce the levels of anxiety of people by giving them the right information? How do we ensure that people do not stop going to the hospital, you know, for very many other things, just because they're trying to keep themselves away from, you know, COVID-19. And what has then happened, and I think we are continuously seeing that, is that moving away from the numbers and the statistics and the data is giving the stories a human face, you know. So when you're able to see people that you can identify with, people that you can relate with, you know, they more or less look like you and I, and they're telling you they've been able to go to a hospital facility and get good care. They're telling you, you know, they've fought the, you know, the disease, you know, they had COVID and they're out of it. You know, it kind of gives you some semblance of normalcy, and that then makes it easy, you know, for you to be able to go out there and access the same care. But that also brings with it, you know, ethical dimensions, because you must also respect, you know, the privacy of those individuals, you know, that you're using to be able to tell the story.
At this point, we'll take a short break. When we come back, patient cooperation is also cited as a crucial link to providing quality healthcare. We'll talk more about that and much more. Stay with us. Welcome back to Health Diary. My name is Gladys Gachanja. Today the conversation is on excellence in healthcare, and helping us along is Dr. Bukka and of course Professor Temmerman. And patient cooperation, as I mentioned before we went to break, is crucial in this conversation. What are the impediments you see as you deal with the masses?
It is so important, and you mentioned already Dr. Google, right? A lot of patients now, they come to your clinic and they have read so many things and they don't know what, what is now real, what is true. So on the one hand, you have patients who know too much and not always the right things. On the other hand, you have a lot of ignorance, people who don't know what you are talking about, or others who don't believe. So it is really important to have a good communication with your patient, to have good media who can explain, and to bring it into the context. And let me give you an example of cervical cancer. In this country, too many women still die of cervical cancer, a disease that is actually preventable because it's a long time to develop, and you can go for a screening. But many women don't go. In Kenya, it's very low. And many women don't go because of what? Because of non-availability, non-affordability, yes, but also because of fear, because of stigma, because of even women who come here to the hospital and who know about it. When you explain everything, then some of them, they don't come back because they say, well, I'd rather die with my cancer than having to tell my family, my husband, about this cancer down there, because there is a kind of a stigma around it. Not for everyone, but even in, some educated women. So I think it's a matter of giving the right information, the right way that it's understandable. We doctors are not always very good in clear information sometimes, but the nurses, they help us then. They are better in information and communication often. But also the patients, the women have to understand what we are talking about. So this kind of the media play a very important role.
Speaking of which, how can information be used as a tool to recruit the masses?
At different levels, and I think what Professor here is talking about is the need for a lot more collaborative engagements, even just between the doctors and the patients. You're looking at a context, and that's why understanding the context in which medicine is practiced is integral. But that collaboration also needs to happen, beyond that space, between those in medicine and the media, whose main role is being able to provide that information. So how do you ensure that the platforms that are in use are accessible, to the public? And so an integral component is finding out, for those that have no access to information, they have no access to data, they have no access to internet, they have no access to that technology, what would be the best way to reach them? It's one thing to know the platform, it's also another thing to understand what's the language of the people. So breaking down this information in languages that resonate with the different communities. And what are those nuances that sometimes don't come to bear? If the doctor is male and the patient is female, what are those cultural nuances that nobody has told us about? If there could be an age factor, that you have to be aware of. And once you understand that, then you're able to package the information, you're able to communicate, with those that are accessing this care in a way that, resonates with them.
Mm-hmm. And resources are key in delivering the quality healthcare we're talking about. And case in point is this pandemic, where we have seen miracles happen in record time. Dr. Temmerman.
It's really historical. Take the vaccine development. For other diseases, we are struggling already so long. And now COVID, we are all kind of, wow, this went in 1 year time, we have several types of vaccine. It doesn't just come from heaven. It's building upon all research that has been done already in the vaccine world for other viruses, for other diseases. So building up that knowledge is so important, experience, technology, innovation. But that requires investment, it requires money. Not only vaccines, but also medication to treat COVID patients. It has never gone so fast as with this pandemic, of course, because the whole world is in the same situation, right?
And still on the same, what can the area of research, or how can it be regulated to ensure quality over commercialization?
Yeah, that's a very, very good question. And I think there is a lot of thinking going on now with this pandemic. WHO, other organizations, they are calling for emergency preparedness. So research is called for on health systems, on innovation, new technologies, but also on what are the regulatory requirements. And then this capacity building is important. Secondly, investing in regulatory frameworks and ethics. So that is also something, a platform that is taken up. And then number three, really important, you can do great research, you can publish papers, but if you don't translate that into policies and practices, you have paper, but you don't have really improvements and outcomes.
Leadership is closely tied to this conversation because it dictates the provision of these resources we're talking about and how they're used. Dr. Bukar, when you think about this, how does successful leadership look like in terms of quality healthcare?
Successful leadership is one that's adaptable. And I think what we have seen with the pandemic is that there's been a lot of adaptability, agility, you know, in the way that we do business, in the way that, you know, we are, you know, interacting with patients. You know, there's now an advent of, you know, telemedicine. What COVID has done, it's also made us confront the different things that, you know, what are the losses that have come with it. And for many leaders, for those who are in leadership, the greatest challenge has been, you know, people do not fear change, you know, or they're not averse to change. What people are averse to is the things that they're going to lose, you know, and once you're able to confront those losses, you know, in ways that people can see that if I lose this, you know, then I have a lot more to gain. Then they become more acceptable to it.
And ladies, even as we bring this conversation to a close, they say prevention is better than cure, and that is the essence of preventative medicine, to promote health and well-being and prevent disease. How can journalists, communicators help promote this, Dr. Bukar?
Very good question, and that's what, you know, we spend you know, time at the Graduate School of Media and Communications, you know, doing a lot more in terms of just ensuring that there is, you know, an immersion in reporting. If you look at most of the newsrooms, the health desks were dominated by women. We are now seeing a lot more attention being given to not just who's reporting on health, but what's the quality of the reporting that they're giving. So there's a lot more collaboration. There's need for a lot more collaboration, a lot more of investigation, and a lot more of resources, you know, need to be put in, you know, to be able to capacitate the health desks, you know, so that they're able to read data, make meaning out of that data, you know, follow through in terms of these advances that are being made in medicine. You can't have a health reporter who's just reporting from their desk. They would need to be, you know, in the hospital, you know, talking to doctors. They'll need to talk to researchers to be able to figure out, you know, what are some of those trends? What are the gains that are being made? How do they make meaning out of this research, you know, for their consumers? Because when the health of a nation is compromised, it doesn't matter what else we are doing right.
Yeah. Very well said. And finally, Professor, education and training, as Dr. Bukar is saying, is so imperative in this. How are you addressing this at AKU, and how can this help contribute to global issues?
We here at Aga Khan University, we have postgraduate medical education. That means we train specialists, gynecologists, surgeons, doctors, And we invest in all these different specialties. In addition, we have a very large program for midwives and nurses, SONAM. And now we are opening an undergraduate medical education. So soon we will have our medical students here. It's really targeting the needs of the population, and it's emphasizing also prevention, promotion, public health, population health, and of course then also the specialties. And all this gamma is needed to really have the best health care.
Ladies, thank you. Professor Merlin Temmerman, Chair, Department of Obstetrics and Gynecology, and the Director of the Center of Excellence in Women and Child Health at AKU, and of course Dr. Nancy Booker, Assistant Professor and Director of Academic Affairs at the Graduate School of Media and Communications at AKU. Ladies, this was a very informative conversation on the importance of investing in excellent healthcare. Well, time now for a health tip.
This exercise is ideal for strengthening your arms because it does not have as much resistance as push-ups. All you have to do is place your hands on the wall, then press in until your face almost touches the wall, then push back until your arms are straight. Then press again, push back, just like that. The secret to getting the most out of this exercise depends on the distance that is between you and the wall. The farther you are from the wall, the more challenging and the more rewarding the exercise is. You can also make this exercise more fun and more challenging by doing the wall push-ups. Since it's a light exercise, do as many reps as you can. Aim for 50 or even 100 reps. If you want to get better at push-ups, start with wall push-ups and eventually move to push-ups.
A lot of information shared on this episode on excellence in healthcare. Thank you for being part of it and also engaging us on our social media handles. My name is Gladys Gachanja, and we have been coming to you from the Aga Khan University Hospital. Until next time, see you. Quickly. This is not working for me. Nimepotelewa na words tena. Guy, inanispirashanga sana. Firirida, yes. Good. All right, excellent.
Thank you.